The use of orthotics. Many of our students wear orthotics. Typically, you're going to see students wearing an AFO. An AFO stands for ankle foot orthoses. Why do students need to wear AFOs? They help to maintain a good foot position, they provide appropriate ankle stability, and they prevent further changes or deformity of the foot. How do you put on an AFO? So first you're going to start by opening the AFO up. A lot of times there's an inner boot. You can just about see it there. You're going to use the inner boot first. You're going to open it. You're going to bend the child's hip and the knee. You're going to place the AFO behind the foot. And then you're going to try to get the heel into that inner boot as far back as you can possibly get. An easy way to do that is to get the heel back. You gently push down on the top of the foot right there, and then you can look through the back of that inner boot and see where the heel is at. Next up, you're going to insert the instep pad, or we also call it a Pringle. You're going to lift up the sides of the inner boot and put the Pringle underneath the sides. Make sure it's centered over the curve of the ankle. Lastly, you'll check the foot position. With the knee bent, you gently push down on the foot or on the knee, and you push up on the foot, and the heel should be seated far back in that inner boot. Next up, you're going to secure the straps. You're going to start with that instep strap. That's the one at the center of the foot near the ankle. You're going to thread it through and pull it snug. Make sure that it's snug because you don't want that foot to move around in there. Next, you're going to do the forefoot strap. And then last one you're going to do is that top strap. Things to look for when you are using AFOs with students. First off, an AFO should not hurt. So if a child complains, the foot should be checked for red marks. This would require you to take the AFO off. If a child is not able to complain, but they're crying or they're grimacing or they look very uncomfortable, it may be because of the AFO. You may need to do a skin check. You might see some redness present when the AFO is first removed, but that redness should not last for more than 20 to 30 minutes after the AFO is removed. So you may need to take it off. If you see redness, then do not put the AFO back on and recheck that area in about 20 minutes. If the redness is gone, then it's okay. If that red mark is there, you should check the sock for any wrinkles and ensure that that foot position is positioned correctly in there. So if the redness goes away, you could try to put that AFO back on. But if that redness does not go away in 20 to 30 minutes, you're going to notify the PT and the parent so that the appropriate adjustments can be made. Places that you may see redness when using AFOs, you may see it at the ankles. A lot of times students will get redness up there at the ankles. You may see it on the back of the heel, either up here or down here. You may see redness at that heel. Sometimes you might see it on the inside of the heel. You may see it at the instep on the inside. There's a bone right here. A lot of times children will get redness right there at the instep of their foot. And lastly, you may see some redness or blistering on their toes from where the sides of that AFO or inner boot can be rubbing on the toe. This is a video on how to how to put on an AFO. So you don an AFO to put it on and you doff to take it off. So let's watch the video.
All right, so today we're going to try on articulating AFO and just go through the steps and how it's put on properly. You always want to make sure the patient is sitting and nice and relaxed in a chair. If she can lean back against the wall, that's perfect. Or if she's not able to sit up properly, then maybe in the corner of a couch or somewhere where she's well supported and relaxed. The important part is to have her be relaxed. And it's also helpful if there's any tightness in the muscle back here to have the knees bent. So we're going to bend your knee up just like that. That helps take some of the tension off of the knee, make it easier to get her heel all the way down in. Okay. This particular brace has a two-piece design with a molded inner boot, and this is a real flexible material. So we just want to kind of lift her leg up and scoop her foot in, just like that. And again, it's best to have her knee flexed, and then if we can rest her heel either on the edge of the chair or on your own knee, just so that her own body weight will help to push her heel down in. Okay, and then there's a little pad. This tucks in right on the top of the foot here, just like that. And you always want to make sure there's no wrinkles in the socks, so pull those out. And that goes in just like that, and then these two straps just crisscross onto the Velcro, which I didn't put on yet. I'm going to place that here while you're here today, just like that, to hold her heel down in. The top strap does not need to be very tight. That one can be loose, but these we want nice and snug to make sure her foot doesn't slide up and down at all. And then we always have a peek hole in the back. If I look back there, we should be able to see her heel right up against the back on the inside. Okay? And the last thing is, once we get that strap, pull the wrinkles out of the sock here and here just to make sure that it's smooth underneath that pad, and then she's good to go. Sound good?